Thank you very much, Pat. Hello, everybody. Thanks for joining us here on the traditional territory of the Kwanlin First Nation and the Ta'an-Kawachin Council. I'm pleased to be here again with Dr. Hanley and Mary to provide an update on our government's response to COVID-19. As you know, we announced a probable case of COVID-19 this past weekend. Dr. Hanley will have more to say about that in a moment. This development and the rise in cases across Canada is a reminder that we are not out of the woods yet when it comes to COVID-19. Here in the Yukon, we remain in a state of emergency. The state of emergency is an important part of our response efforts. Without the state of emergency, we would not be able to enforce the safety measures that we have made under the Civil Emergency Measures Act to protect Yukoners. For example, we would no longer be able to enforce self-isolation for people entering our territory from outside of BC or the other territories. We also would no longer be able to enforce the requirement for those transitioning through the territory to stick to the designated travel corridor and move through the territory within 24 hours. These and other measures remain important to protecting Yukoners from the spread of COVID-19 in Yukon. Under CIMA, we have also put measures in place to support businesses and individuals impacted by COVID, such as the Residential Landlord and Tenant Order, which provides financial support to renters and tenants. The state of emergency has made it possible for our government to respond and adapt rapidly to the pandemic and to keep pace with developments right across Canada. All of our work that the government has done is designed to minimize risk and to help Yukoners manage through uncertainty. We know that Yukoners are concerned about the possibility of importation of COVID-19 to the territory, of COVID-19 coming to the territory from elsewhere in Canada. Our government continues to evaluate the need for the state of emergency and ministerial orders issued under CIMA, and will make adjustments in response to the ongoing pandemic situation. We have learned a lot over the past 7 months, including the limitations of the Civil Emergency Measures Act. We believe it is important to consider how we can modernize this legislation to ensure that it meets the needs of Yukoners going forward, and we have asked all members of the Legislative Assembly to work together to identify options to improve CIMA. As a territory, we have done well because we have worked together to protect Yukon and to guard against this pandemic. Nothing is more important than protecting the health and well-being of all Yukoners. We all have a role to play in keeping the territory healthy and safe, especially as we move into the colder months when we will be spending more time inside. We continue to urge all Yukoners to practice the Safe 6. Wash your hands often, maintain physical distancing, stay at home if you're sick, travel responsibly and respectfully, self-isolate as required, and follow gathering guidelines, including limiting indoor social gatherings to 10 people if they are not in your bubble. It is also important to stay informed and to stay up to date on where we are as a territory. Rumors travel quickly and can cause unnecessary panic. Accurate, up-to-date information about the current situation in our territory is always available at yukon.ca. This is where you can find out about active cases and the risk, if any, to the public. We will continue to share information as it becomes available and keep you informed about what is happening in the territory. These weekly briefings are also important sources of accurate information. So again, thank you very much for tuning in the past and again tuning in today. Thank you very much. Dr. Hanley.
Thank you, Premier Silver. And good morning. Bonjour tout le monde. And I will be adding to the Premier's comments about sources of information as I go. I do hope everyone had a great long weekend and found ways to celebrate Thanksgiving with family and friends, whether virtually or in small gatherings. I did see lots of bonfires glowing in the dark, and I heard cheerful voices in those beautiful nights that we had over the long weekend. I'm sure everyone would like news following our announcement on the weekend. On Saturday, we did announce a probable case of COVID-19 following tests carried out on the Gene Expert Analyzer at Whitehorse General Hospital. The Gene Expert testing tool is a relatively new tool in our COVID toolbox, and our current process with the Gene Expert is that tests require validation at British Columbia, generally at St. Paul's Hospital. We announced it as a probable case while awaiting confirmation from BC, knowing that we may need to wait a day or two before getting those results. As it turns out, the person who tested as a possible positive on the Gene Expert machine has tested negative on follow-up testing at our referral labs, both at St. Paul's and BC CDC labs. To be honest, the test results left us puzzled for some time. But in consultation with our medical microbiologist specialists in Vancouver, and after retesting in Vancouver, we were able to conclude that the Gene Expert test results could not confirm COVID infection. These machines detect viral genetic material at extremely low levels, so low that the presence of viral material could either be due to a false positive or to a previous infection, perhaps several weeks or more ago. In some cases of COVID-19, shedding of non-infectious virus can persist for many weeks and even months and lead to this ability to find trace bits of viral RNA on test results. What we can be confident about is that this person did not have active COVID infection in Yukon, is not contagious, and could not have introduced any infection into Yukon. This is therefore not counted as a case of COVID infection. While we were investigating the circumstances of this case, contacts of the person were identified, and some were tested according to how close they were and whether there were symptoms. Needless to say, all of the tests done on contacts have come back negative. Despite the complexities of this particular case, the tracing and testing worked as it was supposed to. The individual did not circulate within the community, but stuck close to home, and YCDC was able to test and eliminate contacts during the investigation. As for our previous announcements, such as the case that was treated in hospital last month, or the exposures associated with visitors, or with the last confirmed Yukon case, these cases or events all serve to remind us that COVID is always around and could show up when least expected. We continue, meanwhile, to demonstrate that we can handle these occasional introductions of COVID into our territory, but we need to be continually prepared in the way we live, play, or work to ensure that any introduced virus does not spread. That is why we repeatedly come back to the same advice that you hear echoed around the country, regardless of what stage of pandemic any region of the country finds itself in, and that is summarized in our Safe 6 advice. You may wonder then, after this story, whether the Gene Expert is a reliable test. This, our local testing machine that uses PCR technology to amplify the presence of viral nuclear material. It will pick up even small amounts of virus, which is where, at the extremes of low amounts of material, it is subject to some interpretation. Any lab test has its limitations, with false negatives and positives possible for any technology. In the majority of times, if the test is used properly and all the right procedures are carried out, a positive will be positive and a negative, negative. But there are always occasions when it is not clear. At these times, it might take repeat testing, careful inquiry, and consultation with experts to be able to arrive at a diagnosis. We remain fortunate to have this technology available in-house, and as we gain more local technology and build our capacity, we will also be learning and talking about the value and limitations of any particular new device and where it could play the most useful role. Good access to reliable testing is one of those elements that allows us to live with COVID. After the initial test result on this patient, the YCDC team worked through the weekend identifying contacts. The case, who wasn't a case, turned out to have been very limited in contacts, and we had no public exposures to worry about. Keeping safe in this way, limiting contacts, avoiding large gatherings, particularly indoors, observing the Safe 6, means that at any time a case does arrive into Yukon, the consequences should be minimal. It is in this way that we can continue towards a path where we have as open a society as we can tolerate without overly exposing ourselves to COVID risk. You will note when describing this case that I'm being very careful about how I describe the individual. I have not identified gender or age or anything other than this individual had returned to Yukon from outside the territory and was in Whitehorse. We're often asked why we don't release more details about individuals who test positive. There's clearly a strong public interest in knowing as much information as possible, but there's also a strong societal and ethical value in protecting privacy. I have seen, even with this last individual, rumors circulating about who's positive and who is not, often driven by either intense curiosity or anxiety or even fear. These events provide us an opportunity to review who needs to know and why. Remember that we're always living with COVID risk, and my duty is to provide enough information to inform that risk, while protecting information that could lead to identification of individuals, their families, or their communities. One case investigation generates many, many phone conversations, whether as part of the contact tracing or as part of due notification to people that really need to know. Even when providing information to senior leaders, I withhold key information in the interest of protecting that individual. The key information that the public needs to know is, what is my risk of exposure, and therefore, what do I need to do? Please remember that you always need to be acting as if COVID might be around in how you observe the Safe 6 measures in our current everyday lives. Through YCDC and or community nursing, we will notify individuals who may be at risk of exposure, either through direct phone calls or through public notifications. It may take hours to days to complete initial investigations. For this recent case, that was not a case, most contacts were notified within hours and most of the rest within 1 to 2 days, and this over a long weekend. We're constantly weighing this delicate balance of providing information important for people to know, with the ultimate goal of protecting the public's health, against protecting personal privacy, which is a fundamental value and a law in our society. Unless there is a reason for people to know, the public does not have an automatic right to this information. One of the wonderful aspects of life in Yukon is that we are close and well connected. We are each only a degree or two away from knowing anyone else. In such a place as ours, rumors easily circulate well ahead of actual information. So we have to take confidentiality measures a notch up from larger jurisdictions. For every case, we weigh the public's need to know against the potential harm of disclosure. In only a few instances, we have had to issue public notifications, only a few since March. And while we have committed to transparency, we also have to look at the potential harm that releasing more information can cause. We do not want to see individuals erroneously identified because people think they know who they are. We don't want to see them identified on social media and shamed because they have COVID. Please remember that those with a diagnosis, or even those who may have symptoms, are not material for social media. Ignore the rumor mill. You will be contacted if you need to do something other than what you are doing or should be doing every day. If you are just a contact of someone else who is a contact, that does not make you a contact. What does that mean? It means that if you have just been around someone who has been asked to self-isolate, it does not mean that you have to self-isolate. We need to care for each other by respecting individuals' right to privacy and not contributing to fear and shame by publicly speculating about cases and contacts. And here's a critical part. By preserving confidentiality, this is how we continue to be able to get trusted and trustworthy information from cases under investigation and their families, so that we can get the best information to inform our public health approach. And that's the way that we can help to protect Yukoners from COVID. Please trust only solid sources for information, and there will always be normal, formal notification and information on the yukon.ca website. Our bubble with BC has been open for more than 3 months now, and we have seen 2 cases in territory since then, one local and one an outside resident in hospital. So far, we have had these rare introductions of cases or events that wake us up to the reality of COVID. Considering that we are open to people coming and going, and that thousands have made that trip going from BC into Yukon and back, we continue to do really well. A single confirmed case, an outside resident in hospital here, 2 travelers coming and going from outside. That's about all we have seen in this long period of being exposed to BC with no self-quarantine or border entry restrictions. It tells us that people are not traveling a whole lot, but when they do, they are mostly doing the right thing. It also reflects that BC is largely doing well even when they are seeing an increase in cases since the end of the summer. Even with multiple outbreaks and community spread, BC is doing well, especially since they reintroduced some of their early public health measures to help control spread and stay on top of the disease. Some of the indicators from BC that are reassuring are that the majority of cases can still be traced back to known cases or outbreaks, that the positivity rate of testing is just over 1%, and that the curve appears to have flattened compared to a few weeks ago. As we have managed this deliberate opening to BC, some ask about the what if. What if we do see large outbreaks or large importations that result in community spread? What is community spread anyway? It's important to remember that community spread or transmission means that the disease is no longer limited to single cases or clusters or even outbreaks, but it's spreading from one person to another without a clear link between people. It would mean that we would be finding more and more cases that we cannot trace to travel outside or trace to another known case. Some provinces are seeing community spread, all the major provinces, and now somewhat in smaller ones like Manitoba as well. If we got there, the most important thing would be not to give up. Our work then would be to hunker down and reinforce the Safe 6. We might have to reintroduce restrictions, although, like in other parts of the country, including BC, we would try to be strategic and focused, going to places where we're seeing the highest risk. Our challenge will always be to strike the right balance between restriction of movement and keeping COVID risk manageable. Community spread would mean reinforcing protective measures to those more vulnerable. We might have to be more strict in visitors to long-term care and to our other care facilities, to reinforce and strengthen screening for COVID risk factors, and looking for any settings which are posing a higher risk for COVID activity. Although I know we could manage community spread, I don't think any of us want to go there if we can avoid it. So keeping in this mode of containment while striving to be as open as we can help us live with a tolerable degree of COVID risk. We need that in order to work, play sports, go out, keep our kids in school, play music, and sing. If COVID activity settles down in other parts of the country, we can take another look and give the best advice we can on relaxing self-quarantine measures to other jurisdictions. We're not there yet as we look around the country, but we're continuing to watch and continuing to estimate when that might be a safe enough thing to do. Meanwhile, recent events in our look around the country remind us that we have this chance to stay well prepared. We have this chance to review how well we are complying with COVID risk. Take the workplace as one important example of an environment where higher risk practices might be occurring, especially as we start to stay indoors more. If a workplace or meeting area does not feel right, it probably isn't right. Make sure you're comfortable with the setup. Ensure that people are not coming sick to work and are supported to be able to work from home or stay off at home. How many people are gathering for work meetings? How organized are your interactions with each other? Are they appropriately spaced? Does the room seem to be well ventilated? If it feels stuffy, then do something about it. Keep meeting times short and keep numbers in a room small enough to allow for adequate spacing. Check the physical distancing guidelines for businesses online at yukon.ca and also check the cleaning guidelines there. If you haven't already, please have an operational plan filled in for your business or workplace. This will help you ensure that your work practices are compliant. Use the Yukon Workers' Health and Safety Board information as well. There at the WCB website, they have lots of additional resources. And that's all for my update. Thank you. Take care of each other and stay well. Masicho.
Thank you both. We'll go now to the phone lines, and we'll begin with John Kennedy, CKRW.
Hi, Dr. Hanley. I was wondering, where are the conversations in regards to opening the border to Alberta or any other jurisdictions in Canada? Where do they stand? A lot of industries rely on tourism, and the aviation industry in particular could probably use the boost from Alberta or other jurisdictions.
Yeah, thank you, and I think I'll let the Premier speak to that as well. Again, I'm providing the advice. It is a really important question. It's also a question that we have to keep in mind in an environment where people in Canada are not traveling. There's very little tourism occurring and very little travel occurring. And of course, international tourism is all but shut down. So that is the reality that we are facing. At the same time, we do know, I'm very conscious of Yukoners who want to be able to travel more freely to other areas of Canada apart from our bubble. So again, it's really a matter of acknowledging that there is a risk. The more we relax self-quarantine measures, the higher the risk that we have to then take into account of tolerating. And as I say, we have been doing that very well. So it's really a matter of watching the epidemiology. BC is a bit of a special case. It's of course a very large jurisdiction, the third largest in Canada that we've opened to. I do think that, again, that was a move we took some time ago. It was a bold move, I think, and a deliberate one, and we've done very well, as I've said. We also do have a very special relationship with BC, less direct and less intimate with the other jurisdictions. All to say, we're looking. We're clearly in this, we're seeing second wave activity in most of these other jurisdictions of interest, particularly Alberta, Ontario, and Quebec. And we're watching and trying to do our calculations and formulate advice as we go for the government to consider.
Thanks, Dr. Hanley. Not much more to add to that, other than, of course, the way that we move through our phases is by, having direct conversations with Dr. Hanley and his team as he speaks to other chief medical officers of health across the nation. Anecdotally as well, the tourism industry definitely suffered this year. We were the only small jurisdiction in Canada to be open to a bigger jurisdiction, and we really didn't see the numbers of people in BC that came up compared to last year. This year we had just under 12,000 BC residents visit, a far cry from the amount of travel that we would see from BC alone in a regular year for tourism related travel. So that being said, we're not in a place right now where people in Canada are traveling. We saw from the Conference Board of Canada very low numbers of people willing to travel for tourism reasons right across the nation, like outside of people's regions. So we must continue as a government to provide relief to the industries. That's why the Business Advisory Council was created very soon after the declarations, very early on in the pandemic. That's why the cancellation benefits were put in place very, very soon after we, realized that we're going to have to be moving through these phases and preparing for a new normal. So, we definitely are having encouraging conversations with Dr. Hanley about the traceability of other regions. Things like rapid testing is helpful in understanding the virus and understanding how it moves. And this information is going to help us as well. We would love to be able to move further into this phase, our last phase before a vaccine. But again, we are kind of in a holding pattern right now based upon the epidemiology in other regions. As traceability increases, like Dr. Hanley's been very clear that it's not a per capita number that we're looking for. It's more about our understanding of the virus in particular regions in Canada. I will do my part on the national level, talking with the Council of the Federation as far as what our plan is for international tourism. We have an amazing direct flight with Condor to Germany. So watching the numbers, the epidemiology in Germany is something that we are keeping close tracks on. But again, international borders and considerations is a federal decision. So we're working with all of our government partners to make sure that we're striking the right balance. And in this new normal and this holding pattern, we have to make sure that we have dedicated funding available to the tourism industry that is suffering right now.
Thank you. John, do you have a second question?
I do. I'd like to actually take a complete 180 to the concept and ask, what's the level that the government would consider shutting down again? We've seen a spike in cases in other jurisdictions across the country, as mentioned before, and I'm just wondering, I guess, what's the threshold for, shutting things down again?
Yeah, good question, and a good time to remind folks that we do have a path forward, our plan through the phases into recovery, and there are 6 triggers that are identified in that plan that identify what would have to happen for us to trigger forward or to trigger backwards. In a nutshell, we're talking about epidemiology, so we've already touched base on that, communities' ability to communicate amongst governments, the medical community and the healthcare facilities' ability to cope. These are all indicators that are identified in our plan to recovery.
Thank you. We'll move now to Nick Wells, Canadian Press.
Hi, I believe this is a question for Dr. Hanley, and I wasn't 100% sure of the stance, but will you be reevaluating the use of the Gene Expert device?
No, not in the sense of will we use it or not. No, I mean definitely it's an extremely useful tool to have. We've used the Gen Expert, although it's only been online for 2 or 3 weeks now. We are accumulating testing experience with it. It has helped us to rule out infection in certain cases where it's been a real advantage to have that information right away. So it's been kind of humming away and being useful for us quietly in the background. Certain clinical scenarios, especially within the hospital. It will be part of it is kind of a reserve capacity. So it is an extremely useful tool to have if we were to have an outbreak and we needed to test lots of people in a short time and really be able to turn around those test results so that we can inform people appropriately. That is one of the reasons we acquired that machine. And really part of this is really getting to know again the limitations. Every technology has its limitations, and part of it is just getting to know when it's calling out those extremely low amounts of viral material. That's actually reflected in high numbers because the numbers reflect the number of cycle times that you have to go through to amplify the virus so that you can detect it. So when we see, so we're really learning more about how to use it and how to integrate it with our other testing paradigm, which is currently the referred out testing. So this is part of the learning process, and also just finding its place in our testing armamentarium.
Thank you. Nick, do you have a follow-up question?
I don't. Thank you.
Thank you. We'll move now to Dave Croft from CBC.
Hi, Dr. Hanley. It's Dave Croft. So I was kind of confused about the false positive. Did it come from the viral amount was so little or so old that it couldn't even be identified, or was it identified as related to the virus that causes COVID, but so old or minute that it wasn't considered dangerous at all?
Yeah, and maybe all of the above. So I think it's a matter of when you're dealing with really scanty amounts of viral protein, which is coming from the genetic material, that it becomes potentially cross-reactive. So it becomes similar to other bits of viral material. So there is a potential for there to be cross-reactivity and therefore false positive. So it just becomes, the less and less, if you just imagine it, the less and less viral material you have, the harder it is to distinguish between other stuff. So this is certainly consistent with a previous infection, where you, as I said, you can get that shedding time, that prolonged shedding of virus, and as I say, that can be weeks to months that you can continue to get shedding of virus. But it's really, the essential infectiousness is 10 days from onset of infection. And after that, and that's one of the reasons why it can be problematic to try to retest people to ascertain whether they're recovered or not, because of that ability in some individuals for the virus to just continue to be shed from. But it's old virus, it's non-infectious. And as I say, so it's consistent with a past COVID infection and continued shedding, but we can't prove it because the amount of material is so scanty that we can't definitively prove that it was an infection, or possibly it's just picking up some other material. I don't know if that helps, Dave.
Do you have a follow-up, Dave?
Sure. Yeah, thanks. Just on testing, we've heard from a couple people recently this week about they thought the testing results took longer to come back than they were expecting. I think they might have been told 3 days, and it was longer than 3 days. Just if there is a delay, and I know it's not your responsibility, but if this is a backup in BC, I think people were under the assumption that all those kinds of problems are going to be dealt with over the summer, so that if there was a second wave, there wouldn't be delays anymore. I guess the first question is, are there delays right now?
Yeah, we did. It appears that there was a temporary delay, but there's not a consistent delay. So where there were a few days where it appeared that the turnaround times were beyond 2 to 3 days. So I'm actually trying to get some better information on what exactly happened. But we're not consistently. Our most consistent result is still that kind of 3 day turnaround. But sometimes, if you factor in other events like a weekend and a rural location, that can be up to 5 days. In general, though, once it leaves once it arrives at the BC-CDC lab, we're generally under 24 hours to get that turnaround time. So it really relates to a lot of it to transport time, getting into Whitehorse General, getting out of that lab. So clearly there is this chain, and sometimes something goes wrong in one of those chains, and it can be hard to pinpoint exactly where that delay came from. In general, though, we're still enjoying good turnaround times and high priority. We have that kind of coveted priority status at BC-CDC labs. Keeping in mind though that there are occasional, and we read about that in the news, where there are occasional backlogs in BC testing, and they talked about that over the long weekend. They are. yes, they addressed many of the issues that were plaguing us in the spring, and many of those were about interfaces and sheer demand on relatively low testing capacity. As you know, BC testing capacity has hugely improved in terms of the number of machines, the amount of technology, but they're testing a whole lot more, and they're seeing more cases. So, the demand has also changed. So clearly there are lots of interwoven and interplaying factors, but in general, we're maintaining our turnaround times.
Thank you. We'll move now to Haley, Yukon News.
Thank you. Dr. Hanley, I was wondering if you can provide any details on sort of the journey this person took to get tested. I imagine a lot of people are being tested with common cold symptoms. Was there a reason? Did this person have any unusual symptoms that led to increased thought that it might be COVID-19?
As I said, the individual was seen at Whitehorse Hospital and then tested there because there were reports of that there was a reporting of symptoms. So remember, the symptom list is very broad, and we do encourage people even with mild symptoms to get tested. So certainly there were symptoms which triggered a legitimate need or indication to test. I think, again, we really do want to encourage testing, and that can be testing for cold symptoms, for headache, for unexplained fatigue, for any of these things which are not predictable for that person. So, a person might have a headache and it's their normal everyday, or hopefully not every day, but a known, say, migraine headache. That's one thing. But if it's a headache that's out of the blue that is unexplained, then especially if there are other symptoms, then that really gets into that list of symptoms, a long list of symptoms and broad list of symptoms for which we encourage testing. So maintaining a low threshold for testing is one of the ways that we keep ahead of detecting any otherwise undetected COVID in the territory. So if anyone is not sure, again, call 811, use the self-assessment tool, and then go where that tells you.
Follow-up question, Haley?
Yes, thanks. I asked this question a little while ago, back before we saw second wave numbers really ramp up outside the territory. But do you have any advice for people planning holiday travel? And are you anticipating that the risk to seeing COVID-19 might increase in December, January in Yukon?
Well, it's a difficult thing it's a really difficult thing to predict, of course, in terms of where the risk is going to be. I remain, because I think we've been slow and deliberate. That's why we're doing well, and again, trying to maintain that right balance of openness to travel with adequate protections in place. So I'm pretty confident that because of the pace we're going to stay in a good position. Regarding holiday travel, I think it's something to really think about carefully. You have to plan it at this point with the view to, if you do decide to go to self-isolate on return for most jurisdictions in Canada, you have to think about how welcome you're going to be, and what risks you want to take as you travel to areas where you have higher rates of COVID activity. So it's really, I think it's just a difficult decision this year, and maybe think of the reasons that there are. Think of what the alternatives are. Think of perhaps future opportunities when we will hopefully in not too long get to a point where we can much more freely think about travel and unifying families. But sometimes there are just very compelling reasons for travel. It might be special anniversaries or seeing someone that may not have too much time left, or compassionate reasons, or so it really, all of this really has to be weighed into that decision. I don't know if the Premier has anything to add there.
Yeah, I just, as you're answering it, I just think about how hard it is for chief medical officers to predict, and that's, right now is when people are making their plans, their travel plans for Christmas holidays, for that type of thing. So it is very hard to plan, but, great advice, consider why you're going and where you're going and the need. I think you answered it pretty succinctly. Yeah.
Thank you. We'll move now to Gabrielle from Whitehorse Star.
Hi there. Question for Dr. Hanley. I'm wondering if I could get some clarification about the Gen Expert machine. Will it tell you what it's finding traces of? So if you're looking and seeing some viral material, is it telling you, yes, traces of COVID-19 or yes, traces of influenza? And is that why the negative result was a bit puzzling, because it showed traces of COVID?
Yeah, if it were to have, I guess if it were to be able to talk to us, it would say, I think I'm seeing traces of COVID, but I'm not sure. And that's, again, there's so little here that I can't really get a good picture of what it looks like. It's fragmented. There's so little of it that it's very hard to amplify with any reliability. And so I could be wrong. It could be another virus. I think it's COVID, but I'm really not sure at this level. And I don't. So hopefully that kind of summarizes the really what comes to our interpretation of this test result. So it picks up one gene. This usually runs by looking for two particular genes. It picked up one. It didn't pick up the other. And then on another test, it seemed to pick up both, but at very low levels. And then the confirmatory testing could not reproduce those findings. So these, the Gene Expert is just, it is a very, very sensitive test. So it actually picks up smaller amounts of virus than the larger machines. But what the larger machines are perhaps better at doing is telling us when it's maybe more practical to know and less practical to know, because really we're talking about limits of virus that it doesn't make a difference whether it's there or not, because it's so tiny that it doesn't represent infectious material. And I think that's the main reason we were able to come to confident conclusions about what was going on, is that it becomes really an academic question of whether it was actually COVID virus or not, because it's clearly so low in amount that there's no way that it can become infectious. So then it just becomes a matter of kind of curiosity or individual interest, whether this represented old or previous infection or another virus, but it's irrelevant for public health purposes.
Second question, Gabrielle?
Thanks. So just noting that the Gene Expert machine is so sensitive, does that mean that it can sometimes come up with a false positive, but it's unlikely to come up with a false negative?
Well, false negative is really a different. It's a hard thing probably to explain without kind of going through all of the different scenarios. I think the reason that false negative is such a different question is it depends, it relates so much to when a person presents and how early they may present. So if, for instance, you are testing someone who is asymptomatic but incubating the illness, then you may actually miss infection if it's incubating infection. So it really depends on what are the symptoms that are presenting, what's the likelihood of COVID based on those symptoms, and could it be is it giving an accurate test based on that? So if someone is presenting with, say, their day 3 of symptoms that include, say, a cough, fever, and a headache, and it's COVID, the chance of a false negative in that case would be very, very low. the predictability of a positive will be great. But so much of it depends on how much disease is present. What are the other diseases present in the territory? Where is the person in their presenting stages? It's a great question, though, and in general, the false positivity is related to that high sensitivity, or the chance of a false positive. But you're right, in the right person presenting at the right time, it would mean that the chance of a false negative is extremely low.
Thank you. We'll move to Claudiane, Radio-Canada.
Si possible, d'avoir en français, Dr. Hanley, un peu là, la même chose, à savoir qu'est-ce qui s'est passé, est-ce qu'on peut vraiment se fier sur les résultats des appareils GenExpert et voilà en quoi ils sont utiles.
So the question is for Dr. Hanley. Can you please repeat in French generally what happened with the test and where we can rely on GeneXpert or not?
Oui, je vais essayer. Juste pour être à point, c'est un test, c'est une machine, c'est une analyse très fiable, mais il faut avoir les circonstances correctes pour faire les bonnes conclusions sur un résultat de test. Dans ce cas-là, on a appris combien que c'est sensible à très peu de matériel génétique du virus. Donc, ces machines détectent la matériel génétique à des niveaux extrêmement bas et si faibles que la présence de matériel viral pourrait être soit une faux positive, soit une infection antérieure. Donc, la conclusion importante dans ces cas, c'est que c'est représente pas une infection courante, une infection infectieuse, contagieuse. Et donc, c'est le rôle de GeneXpert. On est toujours en train d'apprendre le rôle spécifique de GeneXpert dans notre territoire. Mais l'avantage pour nous, c'est d'avoir une machine avec les résultats dans quelques heures après la prise la prise de swab dans la gorge. Donc, c'est mais on a appris que c'est tellement sensible qu'il faut confirmer le test dans les circonstances où les symptômes sont pas clairs, où la présentation n'est pas claire. C'est très important d'avoir cet contexte avec tous les symptômes, toutes les présentations cliniques pour bien interpréter le test. Donc chaque analyse prend les avantages, les désavantages, les limitations. Il faut connaître l'analyse et voilà, c'est un outil dans notre système maintenant. Et comme on apprend plus et plus l'utilisation de cette machine, ça va jouer un rôle plus et plus important.
Thank you. Avez-vous une autre question, Claudiane?
Non, ça va, merci.
Thank you. We won't ask you to repeat that, Dr. Hanley, since you've already said it in English. We'll move to Marine from Aurore Boréal.
Oui, merci. Bonjour. C'est une question pour Dr. Hanley. Il y a quelques semaines, vous aviez annoncé qu'un simple nez qui coule n'était pas une raison de garder un enfant à la maison. Après quelques semaines, maintenant que vous avez proposé ce plan de rouge, orange et vert, est-ce que vous prévoyez de diminuer de changer le plan, peut-être de diminuer ou d'augmenter les recommandations pour les enfants pour aller à l'école?
So the question is for Dr. Hanley. A few weeks ago, you talked about symptoms that were not enough to prevent children from going to school. at this point, are you thinking of updating the symptoms that you consider as being important, or changing the rules surrounding the presence of children in schools?
Donc, la question, c'est peut-être c'est important de distinguer la différence entre la raison pour avoir le feu de circulation, le rouge, jaune, vert, et l'habilité de tester les enfants. Donc, un enfant peut être testé avec n'importe quel symptôme à n'importe moment. Mais c'était un exercice d'être pratique et de reconnaître qu'un nez qui coule dans notre territoire, c'est très commun. On a beaucoup des enfants qui vivent avec ça, ou dont ça arrive assez fréquemment, qu'on ne veut pas empêcher les enfants d'aller à l'école et de perturber toute la routine familiale à cause de symptômes qui sont très peu de risques, qui posent très peu de risques pour COVID. Donc, c'est comme toujours d'essayer d'avoir une balance pour laisser les enfants d'aller à l'école, mais pour être aussi vigilant pour détecter les symptômes de COVID. Donc, on n'a pas l'intention de changer la direction. C'était vraiment un exercice pour être pratique en reconnaissant des difficultés de jouer avec n'importe quel symptôme qui peut arriver à n'importe. Donc, c'est vraiment d'avoir un niveau qui le niveau rouge pour ces symptômes qui sont très importants et plus prédictifs que COVID, de distinguer ces symptômes-là que les symptômes qui posent très peu de risques pour COVID, et peut permettre les enfants, même après une période d'observation de 24 heures, par exemple, pour évaluer si les symptômes continuent ou si ça améliore, si ça empire. Et donc, d'avoir un système de triage pour évaluer si c'est assez sûr pour les enfants de continuer à l'école. I'll repeat, si je peux. The explanation was around the traffic lights for the school, and I think the rationale behind it, and it's really to try again in the spirit of achieving balance, to try to achieve a reasonable balance between being practical about low risk symptoms and but vigilant enough to be able to detect symptoms that are more predictive for COVID. So it's really that effort to distinguish the red light symptoms from the yellow or the green, where you can have the yellow in particular, where you can take some time to evaluate, are the symptoms improving or not, or if it's just a single runny nose and the kid is otherwise well, that we can allow that to go to school, recognizing that in our territory that's extremely low predictive value for COVID. But it does not change our testing criteria, and it does not change our ability and our call for any child, any parent to test their child or themselves for any symptom that falls in that category, in that broad category that we set out for testing criteria. So hopefully that helps to explain the rationale.
Thank you. Avez-vous une autre question, Marine?
Oui. Est-ce que, Dr. Hanley, est-ce que vous encouragez les adultes aussi à utiliser le système des lumières de trafic pour décider s'ils peuvent venir au bureau ou pas?
So, are you also encouraging adults to use the traffic lights as a way to diagnose if they should go to work or not?
Oui, et suivant le même système, mais en fait, on est en train de faire deux autres fiche supplémentaire. Une, c'est pour, oui, exactement qu'est-ce que vous demandez, les travailleurs qui veulent décider si c'est sûr, s'ils doivent rester à la maison, s'ils doivent attendre pour un dépistage ou si c'est bien pour aller au travail. Donc, c'est le même système, on adapte pour les adultes. Et on va ça va être finalisé et posté cette semaine. Il y a une autre version, on est toujours en train de finaliser et c'est pour les travailleurs dans le secteur de santé où il y a quelques différences importantes. Quelques minutes ou mineures de différence pour élaborer dans un autre avec un autre guide. Just to explain that, yes, there were two other traffic light versions that we are hoping to finalize very soon, and the one is just for people who are returning either to work or to activity or to, it's really a return to activities based on the traffic light scenario for adults. And so we should have that finalized this week. And we're working on another version, which is specifically for healthcare workers about when it's safe to return to the workplace, and if so, what type of personal protective equipment is recommended. So those are our two other versions. Hopefully will be ready in the next few days.
Thank you. And finally to Laura, CBC.
Hi, Dr. Hanley. I'm wondering about the status of the person who was hospitalized in Whitehorse a couple of weeks ago. I understand this is the first COVID case that's required hospitalization in the Yukon, and just wondering how that person is doing now after a few weeks in hospital, but also what the experience has been like for hospital staff, and if you've identified any challenges or issues with the current setup for COVID-19 patients.
Yeah, so parts of that are difficult for me to say because I don't have consent from the individual, apart from what we said at the beginning. But I could say that everything went very well in general. Remember that this is a BC patient, so we're also not providing the public health follow-up. So I can't tell you officially if that person is recovered or not. But in terms of how it went, that was really probably the most rewarding part of that story, is that it went very well in terms of the staff taking care of the person, the comfort level of the staff, and again, because it reflects that this is done every day at the hospital. The hospital has this screening and triage process that sets, according to presence of COVID risk factors or symptoms, it directs patients into pathways which have higher levels of infection control precautions, in this case, contact and droplet precautions, until the diagnosis becomes obvious one way or the other, either through testing or through other means. So really they're exercising this every day. And in this case, it turned out to be someone that did test positive, though the procedures were already in place. The person had been appropriately screened. The precautions were already in place. So there was effectively no change for that person to how the contact droplet precautions that were already applied just simply continued, and the care received was unaffected and continued. So in that case, I think it was a reaffirming of the practices that are in place at the hospital, but I think it was also a bit of a confidence boost that showed that the hospital staff were able to demonstrate and show that they could do this very well and provide a high standard of care for the patient.
Thank you. Do you have another question, Laura?
Yes, thank you. I just wanted to, I guess this is a question for Premier Silver. A couple of weeks ago, the territory changed the border staffing so that two of the land borders aren't staffed 24/7. And I'm just wondering if you've had any issues with people crossing the border and not self-reporting, or any charges under CIMA associated with people who haven't checked in at those kiosks.
Thanks for the question. We had our update on Friday with all of the enforcement folks. No issues so far as to anybody not doing what they're supposed to do. Again, we've explained that the rules are still in place, but so far so good. We did get statistics about enforcement stats, but no bump up because of the change in the border. So it's working so far, and we're continuously monitoring that and updating on a weekly basis to make sure that that compliance is happening. So far so good. We're very happy about that. Dr. Hanley and I have been speaking quite a bit in the month beforehand about how we can get to more of an information provided at the border as opposed to an enforcement presence. And like I say, we haven't seen any cause for concern since we've made that change.
Thank you. I'd like to thank you both, Premier Silver, Dr. Hanley. I'd like to thank everyone for their time today. Our next COVID-19 update is scheduled for Wednesday, October 21st at 11 a.m.